Hey there, welcome back to Vital Stuff. We're sharing critical information for you that hopefully will be valuable in your everyday life, whether it's your health, your well-being, some business tips. We bring really exciting guests to the show in order to share their vital information with you. I'm your host, Dr. Gail Lebovic, and today we're going to talk to Dr. Mariangela Verano. She's a UCSF trained dentist, but she's not just any dentist. She's currently based in Reno, Nevada, and her work goes far beyond traditional dentistry. And as I mentioned, she specializes in the multidisciplinary approach that brings together dentistry, sleep medicine, and breathing techniques in order to help people live healthier lives. In this episode, we actually talked about a lot of surprising things and some powerful ways to take care of your oral health that will impact your overall wellness. We dive into topics like how your gums can get inflamed and spread harmful bacteria throughout the body, the critical role of nasal breathing and how that interacts in your immune defenses. We also talked about lots of other things that I think are really interesting and exciting. Everybody wants to take good care of their teeth and have that $1,000,000 smile. So I encourage you to sit back, relax, and listen as Dr. Verano and I get started. Enjoy.
Well, thank you so much, Dr. Mariangela Verano, for joining me here today. We've just started this brand new podcast called Vital Stuff, and our whole goal is to bring people, really interesting folks who've done amazing things in their life with great accomplishments that bring to the table vital information, whether it's for health, mainly for health, because that's what really interests me. But it's interesting because along this journey, I meet a lot of people who are incredible physicians, clinicians of all different types, who are also business people. So, I like to learn a lot about what took you down on your journey, and we'll just have a nice chat.
Okay.
So thanks for taking the time. I really, really appreciate it. Um,
Well, yeah. Well, I'm honored to be here. Oh my gosh, I just read I read your bio and I was thinking, what an accomplished person. I want to be you. So very, again, very thankful to be here. Thanks for thinking of me. Honored. But well, sleep and breathing has been in my passion for probably the last 15 plus years, maybe even longer. Um, it all started with my family. Honestly, usually that's how it starts. I was introduced to sleep and breathing in great practices in California, in Northern California, particularly Walnut Creek and Pleasant Hill. And I had the benefit of being put together with forward thinkers, forward dentists, and always looking beyond, looking how we can make people healthier. And that led us to sleep and breathing. Um, so, yeah, that's how I got it. Every single child of mine has had an issue with sleep and breathing. So it's really close to my heart, and I really want to help people navigate that because it can be unknown, it can be scary, and you really want somebody to who knows the multidisciplinary approach to sleeping and breathing. It's not just like one cookie cutter thing. It's really individualized, and we need to make sure that every person has individualized care and knows what's out there. Because again, it's just not one modality. It's going to help you. You need a variety of things to help you sleep and breathe better.
wow. Yeah, it is incredible um, to find a dentist who's actually innovative and multidisciplinary. It's rare, as I'm sure you know. So I really appreciate having the chance to speak with you. I want to go back and maybe divide things into two parts today. Um, I want to first talk about your own journey. Like you said, it started with your family and recognizing that there were issues that are bigger than just teeth. It's more of a holistic approach, which has a lot of parallels to my career in breast surgery and breast cancer. Um, but I think one thing I I have to mention is how we met you, because you met, actually, Joy found you on Instagram.
Okay.
And you may not know this, but I'm not a big fan of social media. I don't have any social media, and I really don't, I haven't done that. It's new to me, right? And I've resisted, but my team has finally said, no, you've got to get out there and share the people that you know, the information that you have. And so I'm doing that. I'm willing, I'm willing to embrace that and get into that uncomfortable place. So I appreciate you helping me do that. But she did. She found you on Instagram, and lo and behold, you're in Reno, Nevada, which is where I live.
Oh.
And I know, right? And I need a dentist. So how convenient is that? And I read your bio that you trained at UCSF, which is amazing. I have a lot of friends who are at UCSF and have been there. And just take me back again to like what inspired you? Like, do you remember when you decided, okay, I'm going to be a dentist?
Oh, when I became a dentist? Oh, yeah, I was actually going to my own dentist and wanted to go to medical school, wanted to be a doctor, medical doctor. But I also wanted to have a family. So that was always in the back of my head. So how am I going to do all this, you know? So I went to my dentist, had my cleaning, saw my local dentist I'd been seeing for, I don't know, forever since I was a child. And he said, I know you want to go to medical school, but have you ever thought about dentistry? And I said, no.
Oh,
He's like, well, do you want to have a family? And he hit those like key points, you know? And I said, yes, I want to have a family. He said, well, if you want to have a family, you can work, if you're a dentist, you can work 2 days a week, you can work 3 days a week. You know, this afternoon I'm taking off for my son's baseball game. You can make it what you want. And I said, huh,
wow.
that sounds pretty interesting. So I was at UCLA at the time. I'm about to either take the MCAT or the DAT test. And I volunteered at a local clinic there. I worked at a periodontist office. I became like the vice president of the pre-dental dental organization society or pre-dent. So just kind of dove in, and the more I learned, the more I liked it, and here I am. Now I'm a dentist.
Voila.
Voila.
Well, you have great teeth.
Oh, thank you.
So, which is great because I'm looking for a dentist in Reno.
Okay, well, we're here.
I'll be seeing you soon.
Okay.
Um, you know, to me, what's really interesting is you then got into kind of breathing and sleep, and we'll talk about that in a little bit. But I think there's something about a person's, I don't know, their makeup or their soul, where they go into a profession and they either just show up for work every day, or their brain is kind of on overdrive and they're constantly thinking about how their profession impacts people and how it impacts the body. And they start thinking more out of the box. And clearly, you fit into that category
Mhm. Yes,
because
always learning. Always, I mean,
always
there's
learning.
never a
Yes.
day that I'm not on something to learn about. My husband always says you're only working part time, but you're always working. Well, that's because I'm either learning or watching something or trying to be better because, as we know, medicine is not stagnant and we have to keep on learning because what we learned 25 years ago, 20 years ago is not how we treat today. And I feel like if I don't know a lot about a little bit of everything, then I can't help my patients as best I can. So that's why where the multidisciplinary approach comes into play. So you definitely need to know a little bit about what everybody else does, especially who you're going to refer to. So, so that's I'm always learning. It's
I
just,
love that. I think that's something else that we share in common. You know, I feel like if I wake up every day and I learn something, I always learn something. It doesn't matter what it was. This morning, actually, I got up early and I wound up grooming my dog because I can't get her into a dog groomer. And that's something I learned to do during COVID. And I was thinking about it. I was like, you have to learn something every day.
I agree.
Um, but I also think being passionate and loving what you do, it doesn't feel like work.
No, no. I mean, I can't help my patients unless I know things, right? So, and you only know what you know. So you have to keep learning to help them, proceed even just normal dentistry, right? You have to make sure, like, why are they getting cavities? You kind of have to go down a little more investigation. Like, I don't really want to fill your teeth next year. Like, why are we getting cavities? So for me, it's always trying to look for the root cause, like looking at diet. Even every patient's going to present different. So you actually have to learn the patient too, right? You have to learn like what they do, what they're eating, what their diet is, the microbiome, gut, goes on, vitamins, and a whole bunch of crazy other stuff that you can dive into. But there's so much that's into the mouth that affects the rest of our body that we need to know a little bit about that stuff too.
And that's exactly what I want to dive into next. So, I'm learning a lot about that in studying the nose, which is the neighbor of the mouth. But I think there's a ton I can learn from you in understanding oral health care, right? And take me back and fill in the history of like before there was a toothbrush, right? Obviously, people lost their teeth, right?
Yeah, sort of.
The teeth.
Yeah.
And it still happens. It still happens in a lot of countries. So help us understand the importance of oral health, how that all works, and how it does impact our body, because I think it's essential to
Yes.
modern medicine.
Well, a lot of times, so back in the day, there wasn't really any cavities. Like if you look at ancient skulls, they have all their teeth. They don't have missing
Oh,
teeth.
really?
Yeah. They were chewing 2 to 3 hours a day. So they have broad, wide arches. Yeah, there's
They
not a lot of
have all their
decay.
teeth?
A lot of them have a lot of their teeth and they're straight and there's no sleep apnea or sleep disorder breathing or anything. So if you look at, I think the guy that kind of writes a little bit about that is like Stephen Lin. There's also, it's called The Dental Diet. I'm blanking on the other guy's name and it'll come to me in a second. But it was actually really the introduction of sugar, industrialized revolution,
Refined sugars?
that causes cavities.
Oh.
Also, if we're not chewing and breathing like we should be, we're going to be drying out our mouth, which changes. If we're not nasal breathing, we're not going to be drying out our mouth because our mouth breathing, the pH changes in the mouth, which causes the bacteria that flourish to cause cavities and gum disease, make more toxins in themselves, break down the teeth, and also affect gum disease. So nasal breathing is super important for overall oral health. Chewing, super important. Everything's
Chewing
soft,
what?
hard
Chewing what?
foods,
Like
hard
chewing
foods.
on bones? Or I mean, like
Yeah,
what?
yeah. So chewing helps. Well, this is more as a child, not as an adult. Well, adult too. Chewing helps us develop our faces. So and how our so think about like Angelina Jolie versus like Marilyn Monroe. You'll see she's really thin and more. So evolution, as you see it, our skulls evolve because we're not chewing like we used to 2 3 hours a day, and our foods are different. They're more fibrous. We had to like really gnaw on them. Our faces have changed and become more narrow.
Hmm,
Yeah,
really?
yeah.
Even over that short course of period of time, like from Marilyn Monroe to
Well,
Angelina
that's just like an
Jolie?
example that I give. But if you look at like our ancestors, yeah, like caveman time, you'll see the skulls and things like that. It's dry. I can't remember the guy's name right now, but I will think about it. He wrote a
Is
book
that
about it.
again related to processed foods?
Yes, yes. All those
Okay.
pouches those little kids are using all
Yeah.
day, all this. What are you doing? You're shaking. You're putting a lot of pressure here, and then you're making the your face more narrow.
So
Yeah, as
better
you
to
go.
eat the carrots,
Better
better
to
to
eat the
chew on them.
carrots.
Uh-huh.
Yeah, real foods. Well, and also real foods is going to help you be healthier. Um, so a lot of times people think that not just sugar is what causes cavities, but like those fishies like kids eat, they're carbohydrates. They kind of sticky.
Mm-hmm.
So those cause cavities. Mouth breathing is huge. Causes cavities. Changes the pH again. We talked about a little bit about in the mouth. Um, if you're not nasal breathing, you're also not producing nitric oxide, which is super important for the mouth too. There's like nitric oxide pills you can take. There's like you can eat beet powder to kind of help with that. If you do a salivary test to see like what your oral microbiome is, one of the tests will test nitric oxide and tell you if you're low or high. So you want to be a little bit higher in that, which affects the oral microbiome.
So I've never heard of anybody testing the saliva for that. Is that
Yeah,
something
so
you do in your practice, or is it something we get on Amazon? How...
I'm sure you could probably get it on Amazon because you can get anything on Amazon now. But there's like 3 or 4 tests that you can test the saliva. So let's say you have somebody who's coming in has getting a lot of cavities and gum disease, and you feel like they've done everything. They're cleaning, they're using their water pick, they're brushing, they're eating a healthy diet, they're taking the vitamins, and something's just not right. Like, what is going on? Then we will saliva test them, and then it will kind of tell us what ratio of bacteria it is, because just like our oral microbiome, our gut biome, if the mouth biome isn't like in symbiosis or, together, there's good ones and bad ones, then it can wreak havoc. Now, how does that affect your overall health? Number one, when you have inflammatory gums, that inflammation in the gums causes bleeding gums. When you have inflammation, it's the bacteria that causes that inflammation, takes a free ride all the way through your body, so it can affect your heart, your knees, your lungs, all that kind of stuff. So just think about if your mouth is not healthy, all those resources that the body's trying to, like let's say all the resources are going to the mouth and not to the rest of the body, so you're actually depleting your immune system. Mm-hmm. And then also you're taking that, as we all know, inflammation is super important now. We all want low inflammation throughout our body. So that bacteria that's inflammatory, especially in gum disease, you'll be found in the brain. They find it in Alzheimer's patients. They find it attaches to the lining of the heart, increases the chance of heart attack or stroke. Diabetes, huge. For the inflammation, we want to keep that down. Obviously, if you have acidic mouth, your gut's going to be acidic. It's one passage, right? It starts in the mouth and goes into the gut, so you can have gut issues. So that's kind of a little summary.
Wow. Yeah, that's fabulous. Let's unpack that a little bit more if you're okay with that. I have a lot of questions. So, okay. In general, we want to keep our mouth really healthy. And correct me if I'm wrong, but I always say that, back in the day before we had oral health and there was any attention to really brushing our teeth, that people died younger. And I personally think that oral health has done probably the most to help prolong lifespan.
I could see that.
I mean, maybe I'm wrong,
yeah,
but
no,
I think that because of the impact, because of the impact it used to have mainly mm-hmm. on the heart, right? Cardiovascular disease, endocarditis, all of that. And a lot of people never make the connection between the mouth and having a tooth abscesses and endocarditis. But it goes back to what you were saying. We want to have a healthy oral cavity because there is a normal amount of bacteria that lives in the mouth that's okay. They're good bacteria. Mm-hmm. It's when things get out of balance. I love the fact that you mentioned pH, because I think the pH of the body is one of the things that is really important. We talk about alkalinizing the body to help prevent cancer, right? Mm-hmm. We talk about it in regards to just staying healthy. And I believe it's because it decreases inflammation. I think all roads lead back to inflammation. So everything we can do to decrease inflammation is good. Yeah. Okay. So we've got this natural biome in our mouth, and there's a lot of controversy right now about fluoride and toothpaste and all of these kinds of things. So I'd kind of like to get into oral health. How do we take really good care of our teeth and our gums and make sure that our mouth is healthy? Do we brush, floss, water pick? How many times a day? Tell us what you do. You've got beautiful teeth.
So I believe in brushing and flossing, obviously.
Well, that's good since you're a dentist.
I also, in certain instances, not everybody, I believe a water pick is a great tool. Because it kind of helps flush when they have like bone loss and things. It kind of gets in between the teeth, because if you have kind of like this and you floss, it's too thin. It doesn't grab all the yuckies. So a lot of times flossing is water picking is super important. Huge, again, because we don't get a lot of nutrients from our food like we're supposed to. So I think prebiotics and probiotics are good for the mouth too. There's some that are special for the mouth. I believe in vitamins, huge too, like magnesium, vitamin C, vitamin D, K2. I think all that is super important for our oral biome. Again,
Calcium.
Calcium too. We just don't get enough, I think, from our food because our food is kind of depleted. So you have to supplement with good supplements too. You can't just get any supplement, in my opinion. And then regular checkups is huge because if you see the dentist regularly and they see a flare up, they're going to say, hey, what's going on? Right? Because they've been seeing you every, 3 to 4 months or every 6 months. And if they notice all of a sudden inflammation, they can say, hey, what's different? What have you changed? Is there medicines? What's going on? Let's see, water picking. And then I used to be a huge proponent of fluoride. I have changed my mind, but that is my opinion. I just me. Because again, we're always learning and always trying to be better. So I use a 10% nano-hydroxyapatite toothpaste. There's a whole bunch of different brands out there that you can use. And
Tell me about that. Tell me why. What changed about fluoride? Because we have fluoride in the water. We've got. Talk to me about when did they put that in? Why did they put it in, and why are they taking it out?
I think they put it in a long time ago because of the fact that it does decrease cavities.
It does.
Well, I guess it depends on which research article you read. So they did put it in the water just because they thought it was going to help with dental caries. Now more research is coming out, again, depending on which paper you read, right? Because they're all different and depends on how biased they are, which way or the other. But if you do read the new research, they say fluoride is a neurotoxin, so you shouldn't really be having fluoride. I'm not a big fluoride expert. I just know that what I've read, and for me and for my family, I felt it is best with the new research coming out that don't like fluoride. That's to say, I would rather use the 10% nano-hydroxide.
And you think we absorb enough fluoride when we're just brushing our teeth 2 or 3 times a day? We absorb enough that it could potentially be neurotoxic. Is that the theory?
That's the theory, yes.
Yeah. Okay.
And
okay, well, there goes the fluoride.
Or you can totally, I'm not not going to tell you what to do. And I always say, go do your own research, make your own informed consent. I'm only here to guide you. And I'm an educator. I'm not going to tell you this, that, or the other. I'm just going to tell you what's available, and then you can take it from there. That's just
I just didn't understand. I didn't know why there was all the controversy about fluoride. Learn something new every day.
So that's why.
Okay. Wow.
Oh, and they also say that nano-hydroxyapatite too is also what teeth are made out of, right? So it does help with root mineralization. It's great for sensitivity. It's better than other products out there. I have people that switch all the time and their sensitivity is completely gone. So,
that's great.
Yeah.
Okay. And there was something else I was going to ask you about. Hydroxyapatite. What were we talking about?
Hydroxyapatite. And also, obviously, eating the rainbow, eating healthy foods is also good for the mouth. Yeah.
Yeah. Okay. So supporting our normal flora and keeping our teeth clean 2 or 3 times. What do you think?
I think 2 is fine. I mean, unless you have somebody who really gets food stuck between their teeth, they're going to have to be more diligent. If you have dry mouth, you have to be 110% diligent. You might have to brush your teeth 5 times a day. Just because every time you eat or food, you don't have enough saliva. So the saliva doesn't, you talk about the pH, right? The saliva buffers everything with the pH. If you have no saliva buffering the teeth, it's always dry, so your pH is going to be low. So every time you eat, it drops the pH. Now you have no saliva. So those people have to be extra, extra diligent on oral hygiene, like beyond, or else they will get cavities every single month or every other month.
Wow.
really bad dry mouth can really be really harmful.
Oh, that's really horrible.
Yeah.
I remember, I mean, I would have never been inspired to be a dentist because when we were little, I had a lot of cavities. I did. And I, now looking back, obviously I sleep with my mouth open, so I get a dry mouth, really
Hmm.
dry. And maybe that contributed to having cavities.
Uh-huh.
But when I was little, I had an old-fashioned dentist, and he didn't use any Novocaine or anything. And so it was just kind of like hang on to the chair and then tap on the chair if you want me to stop kind of thing.
Oh,
Oh, it was horrible.
sounds
So
awful.
it is awful. It really was a terrible situation. But things are a lot better these days, which is really, really good. I
Yeah.
remembered what I was going to ask you about. I was going to ask you about dental x-rays because it's always kind of a scary part of getting your teeth cleaned and
Mhm.
examined every, is it every year that you need to have x-rays?
It's usually every year, unless you have like perfect teeth and not much going on, we can extend it to 2 years. So everybody's, again, individualized approach to everybody's a little different. If you're getting cavities all the time, then I want to see those x-rays. Like even I even ask for every 6 months if you are very caries prone and things are changing too quick for me to keep up with. Usually it's every year. You can push it to 2 years if you have nothing going on. You have good teeth, good gums. Again, everybody's a little different. I don't mind doing that.
Okay, that's great. Well, before we get into the breathing and sleeping, I just wanted to ask you a little bit about cosmetic dentistry because that's a relatively new field, isn't it?
No. Do you remember back in the day there was that show? It was called like Smile Makeover or something. It was probably a little like
No,
15 years ago. Yeah, there was actually
no.
a whole reality show on that. It was can't I'll think about the guy's name. But yeah, no, we've been doing smile designs again, came from the Bay Area now in Reno, but gosh, long
Smile
time.
design. I've never heard that term.
Yeah, so smile design is where some people don't have like pretty teeth or they want a nice, smile. You actually take the time and it's almost like building a house. Like you like take x-rays and take images and all that, and then you design their teeth so that they look better. Like if they have broken down teeth or anything like that. But it's almost like getting a roadmap. So instead of just, if somebody came to me and said, I want better teeth and I want 6 veneers, I'd be like, no, we're going to take the time. We're going to think about it. We're going to see how many you need. And we're going to talk to you if you want 4, 6, 8, and these are the reasons why. And then you decide what you want to do with that. But we'll tell you the options. A lot of times, too, we'll do a mock up so they know what they're getting before they actually go in. So it's and you have to look at a lot of things. Your bite. You don't want them, breaking them off because sometimes your bite will break them off. So you have to do is you just have to be careful. In my opinion, if you have a lot of the easy way to do a smile design is go ahead and cut the teeth and put the crowns on. But sometimes one tooth is like here and this way, so it's going to be a lot harder to get those to match. So in a perfect world, again, not like an ideal world, we want to straighten those teeth, get them in the right positions, and then do the things. So it's not as easy as just saying we're going to do all this cosmetic work and be done. It takes some time and planning if you're going to do it the right way. Again, in my opinion.
Well, maybe we can come back another day and just
Yeah.
talk about cosmetic dentistry because I know nothing about it. I was
Yeah.
really fortunate not to have braces or anything like that. Um, but I'd love to learn more about it because I think waking up and having a nice smile is a great way to start the day.
We do a lot of smile designs, and people that have a hard time smiling. Just had one yesterday. How sad is that they are so embarrassed of the teeth that they can't smile. The smile is like the first thing people see, wakes you up in the morning, and it just makes who you are. And just changing somebody's smile can change their life. It's pretty
Oh,
it's pretty impactful. It's amazing. Yeah,
I believe that. And I think it's really, really cool. So I definitely want to learn more about that.
absolutely.
I want to switch gears a little bit, if that's okay,
Yeah.
and just kind of dive into. what got you interested in breathing and how the nose and the mouth interact. Obviously, they meet in the back of the throat, the oral cavity and
Mhm.
the nasal cavity. So again, tell me how that all started for you, because I can tell already you are very multidisciplinary in your thinking, which is very rare for a dentist.
Thank you.
And the dental career is really the foundation that you build upon, as you learn all these other things. And I can see how you live outside the box.
Yeah. All right. So the first part was again, I got sidetracked in my head. Oh, how do I be breathing? Yes. So again, luckily be in the right place at the right time. Honestly, the doctors I worked with started a long time ago, started talking about breathing and sleeping. And I remember one of my doctors kept saying, oh my gosh, this person has sleep disorder, breathing, sleep apnea. I'm like, how does everybody have it? I don't understand. So I started learning more about that with him. Worked in two different great practices in the Bay Area, and the other um, one of my colleagues was really passionate also about breathing, drew me into that. The more I listened, the more I just wanted to know more. Once you go down this rabbit hole, you can't unsee it. You see it
Yeah.
every day. The more you see it, the more you learn. And the more you learn, the more you see it. So that's where it all started, probably a long time ago. I mean, my son is 7 and he had myofunctional therapy when I'm sorry, my son is, oh my gosh, I'm going to date myself, but 26 and he had myofunctional therapy when he was 7. So thinking about that's how long
20
ago,
years.
yeah, been introduced to me. And slowly as I learned, and just really just learned more about it and how it affects our overall health, sleeping and breathing. If we're not sleeping well or breathing well, obviously we can't be as healthy as we can be. So that's how that went. That's how I got introduced to it.
Well, we always say the ABCs of medicine are airway, breathing, circulation. So, like, really, breathing is the first two, because you can live without food, you can live
Mhm.
without fluids for a while, but you can't live without oxygen for very long.
Yeah.
So, it is vital to our life, and our health. So, talk to me about breathing. I feel the same way. It's like once I learned how important the nose was and I started to dig a little bit, there was so much. There's a mountain of information that points us in the direction of, hey, wait a second, the nose is so critical in the breathing pathway and the respiratory system. And we're not doing anything really to support our nose. We're just kind of ignoring it. And it's being bombarded every day with how the world has changed. We're on airplanes, we're in pandemics, we're all over the place in air pollution, we're exposed to toxins all the time. And so the more I studied it, the more I realized that what we were doing was really important. So I assume it was the same for you. It's like you
Yeah.
open Pandora's box and you peek inside and you're like,
Yeah.
oh my God.
Right. Yeah. So you hit it, perfectly. If we're not nasal breathing, we can't be as healthy as we can because nasal breathing it humidifies, disinfects, and creates nitric oxide. And when we correctly nasal breathe, it should be our first line of defense of our immune system. If we mouth breathe, it's our second line of defense. So our tonsils and adenoids aren't meant to um, to you know um, is not meant to clear like the pollutants and all that stuff, like you said, the allergies and all that stuff. The nose is really meant to do that. So we want to make sure we have a clear nose. Number two, the nose is working for you because you can have a nose that doesn't work for you. And also make sure we do some nasal hygiene, just like we brush our teeth. We should always have nasal hygiene of some sort every night, just like we wash our hands. We wash our hands, we brush our teeth, nasal hygiene.
I absolutely love that you said that. And just for everybody, I want everybody to know we have never spoken before, because that is, I don't know if you know this, but I have created a toothbrush for the nose, basically.
Oh,
An antiseptic gel with a device that cleans the nose. It's called NasoCleanse. And that's not at all what
awesome.
this podcast was meant to be, but I'm ecstatic that you said wash your hands, brush your teeth, clean your nose, because it's so obvious
Yes.
once you study how the body functions. So I'm excited, and maybe we can talk more about that and work together on that.
Yeah. So if the nose is stagnant, then there's like cilia in the nose and it doesn't move. So it's almost like having, I don't know, like a clogged vacuum cleaner. It's not sucking air, right? The same thing.
Exactly.
The cilia moves, takes all the allergens and pollutants and brings it back to the throat so that it can be processed. If it's everything stuck, the cilia is stuck, then nothing works. So that's where the nasal hygiene comes to play, because it needs that cilia to move, it needs it to work in order for the nose to work. I mean, there's obviously also if you're not using your nose, you use it or lose it, right? So the more you use your nose, the more it dilates, the more nitric oxide is made. So it's easier for the air to flow. If you don't use your nose, that's when you get the enlarged turbinates. That's when you get the issues of not being able to nasal breathe. Also, nasal breathing helps your diaphragm. It helps your posture. It helps, if you mouth breathe, you're only using half of your lungs, right? You just open your mouth, breathe. It's very shallow. Close your mouth, tongue up to the roof of the mouth. Breathe. You're going to have it. The oxygen is going to go all the way down to your pelvis, your stomach, and it also helps. People that I think like there's a big thing about now pelvic floor. I don't know, something about the pelvis, but it also helps with the pelvis.
It's all connected.
It's all connected. So yeah, and you want the best CO2 O2 exchange in your body, and if you're not creating nitric oxide, which is made mostly in the nose, then you can't have that CO2 O2 exchange. That's why you see all those athletes right now that are like lip taping and trying to do all those nasal breathing.
Absolutely.
Helps with like relaxation, right? All those nasal clearing exercises. Yeah.
And we found that if you cleanse and moisturize the nose in athletes, young athletes who have allergies or sinus problems, you can actually increase the airflow by 25%, which is a huge
Absolutely.
number.
Yeah.
So I am really thrilled to hear that you've learned the same thing that I've learned. Basically, I'm a breast surgeon, you're a dentist, but we both figured out that the nose right in front of our faces is really important, and it's been overlooked and ignored in medicine forever, really. Except for Ayurveda. Are you familiar with the practice of Ayurveda?
I don't know that.
It's an ancient practice where they basically cleanse the nasal passage. I actually have seen it done. You lay on a table and they pour hot oils into
Oh,
the nose and the nasopharynx and they rinse out the sinuses. Yeah.
oh,
To
don't know.
open up the nose. I'm wondering if you see a lot of patients with what I call chronic subclinical sinusitis. So Reno's really dry, it's high
Mm,
desert. And everyone in Reno seems to have allergies or what they think is
yeah.
allergies, or they have sinus trouble, and then they go in for sinus surgery. Then they really have problems because they might remove the turbinates or do something else in there. And then they have dry nose, which can be very painful.
Mm,
So a lot of nasal issues up in our neck of the woods.
right.
And I really think what happens is we're colonized just like we are in the mouth with good bacteria in the nose. But then we get pathogenic bacteria in there, and there's a lot of that floating around, Staph
Mm-hmm.
aureus, and I think like almost 40% of the population has pathogenic bacteria in their nose.
Mm,
And we communicate that to other people, sneeze, cough, airplanes, planes, trains, automobiles.
yeah.
And to me, it just seems so basic that we have to be cleansing and moisturizing the nose, just like our teeth. And
Yeah.
it's amazing to hear you feel and think the same way.
Yeah. It's kind of interesting. I'm not sure if, back in the day, people ever had a nasal clear or nasal hygiene. Like maybe there probably wasn't as many pollutants in the air, right?
Exactly.
You also have to think about a lot of our diet is also inflammatory, right? So
Mm-hmm.
anytime somebody's trying to clear their nose or get nasal breathing better, I tell them to do an anti-inflammatory diet for like a month, see what happens.
Mm-hmm.
I don't know back in the day if people were sleeping with their pets. I'm not telling you not to sleep with your pet, but if you are having issues, maybe just remove the pet for 1 month, see if that's happening. I think we're indoors more often, right? There's air conditioning. There's mold is this huge thing right now in
Huge.
homes. all that can affect the nose. And if the nose isn't working as well as it can be, then you're going to have all these issues. I also feel like if you aren't, you have sinusitis or you aren't nasal breathing because you have large turbinates or allergy or whatever, that means you're mouth breathing. So the more your mouth breathe, the less your nose works for you. So it's kind of like this thing, or you have the surgery and then you don't nasal clean and you don't retrain that nose to work for you because it hasn't been working for you. You continue doing the same things you were doing before. So kind of figuring out, once you get the surgery, the sinusitis, all that, well, let's nasal, clean your nose, make sure you're using your nose so it's working for you because it hasn't worked for a while. And I think the nitric oxide, the humidify the air, because when you breathe, your lungs don't like cold air, it likes warm air too, so it needs to humidify it. So that's what that's my opinion, is like people have all this stuff and then they don't fix the root problem of what caused that in the first place.
Have you, in your practice, do you see a correlation between people who have sinus issues and who have, for example, more cavities? Do you see that correlation? Have you looked at it?
No, because I don't do a CBCT on everybody. Would be nice.
It'd be
But
really interesting.
Yeah, I do know that people that mouth breathe have much more cavities. I can tell you that hands down. I don't never done like a research project. I don't know what their nose looks like, but I can tell they're mouth breathers. Like when someone comes to my office, I'm watching. I watch them from the moment they walk in, just because I'm trying to see like how are they walking, their demeanor. Are they nasal breathing? Are they mouth breathing? Are they, using their whole body to breathe? Like what's going on? But that's just probably different because I'm looking for sleep disorder breathing, nasal breathing, mouth breathing, things like that. So as soon as they walk in, I do look at that, which I would and if they are having more cavities, we have a big talk about mouth breathing, nasal hygiene, what you're eating, what are you drinking, because a lot of people think, I had a patient the other day, I'm like, what are you drinking? Like, why are you having so many cavities? I want to, like, we can't be doing this every couple weeks or every month, or we got to stop this. And she's like, well, I'm brushing my teeth, I'm doing all this. I'm like, what are you drinking? She's like, I'm drinking vitamin water. I said, okay, great. She's like, but it has no sugar. I'm drinking vitamin. Oh, I shouldn't say that word, but anyways, this water, whatever. And I'm like, well, let's look at the pH of that water you're drinking. It was like 3, even though there's no sugar. And she's sipping it all day. So all day long, the pH, we talked about the pH, right? So the pH in her mouth is staying at a low level all day long. And you can drink, not, you have to live, right? You can have some soda, you can have wine, you can have all that stuff. But you just don't want to be sipping it all day, because all day long you are bathing those teeth with pretty much acid, right? So
how about coffee?
I'm okay with coffee. I like coffee. It's one of my pleasures, but I don't sip it all day. I drink it, within like the first 20 minutes. If you're sipping it all day, same thing, pH, or after you're done, just rinse out your mouth with water, just so it doesn't sit there. It's not good to brush because then you're brushing in that acid. But again, I'm not going to tell you. You don't want to just live in it. You can have it, be done with it, and move on. Just don't constantly bathe in it.
Great. Well, this has been amazing. I so appreciate your time. Just to summarize, how about like 3 tips for our teeth and 3 tips for breathing? Go.
3 tips for our teeth: healthy diet, brush, and probably floss. I'm gonna throw one in there: nasal breathing.
How about see your dentist?
And see your dentist. Yeah, sorry. And then the breathing. Again, nasal hygiene, breathing through your nose, and making sure that when you breathe, you don't shallow breathe. You actually breathe all the way to the bottom of the lungs, like deep, long, big breaths. Make sure that your diaphragm is expanding, not 2 ways, but all 4 ways. That's what I would just say for breathing.
Fantastic. I just learned a trick. It's like double breathing. So you breathe in through your nose, you take a really deep breath, and then you take a little bit more. So let's do it together. And that extra breathe out. That extra little breath really expands the lungs and helps relieve stress.
I can see that. Yeah.
And I'm sure there's little receptors in the lungs that release something wonderful, like endorphins or something. Our
Yeah.
bodies are amazing.
Yeah, they are. Well, there's all types of breathing techniques to like, calm yourself. Like I use like these little inhaler, like essential oils sometimes to like, it just kind of helps me nasal breathe better. It just kind of brings me in. I don't know. I like it. So
Great. Well,
yeah.
thank you so much again. And I'd love to dive in deeper on more subjects. We're going to send you some nasal cleanse samples for your
Oh,
patients.
okay. I would love
Yeah,
that. I can't,
that
I
you
can't
can.
wait. I can't wait to use it myself too.
It's great, and I just really appreciate your time. It was wonderful meeting you. I'm going to be making an appointment to come see you.
Well, it was nice meeting you too, and thanks for having me. And again, super honored to be here. Thank you for choosing me. I
It
appreciate
was
it.
a pleasure. It was such a pleasure talking to you, and you know so much.
Well,
Amazing.
keep
Thanks
on
so
learning.
much. I'm serious. I'm going to make an appointment to come see you.
Okay, we'll see you soon.
Okay. Thanks so much.
Bye. Take care.
Bye.